Okay, hello everyone again. I would like to welcome you all to this meeting. We have held I think three meetings so far, focusing on the different aspects of studental problems and issues, and this is the fourth meeting focusing on the students' problem. And I would like to welcome you all to this meeting. First of all, I would like to ask Aryan, our talented, enthusiastic student, to introduce our distinguished guests. Aryan.
Hello, everyone. Good morning, good afternoon, or good evening, depending on where you are joining us from. Welcome to today's international panel discussion titled Modern Assessment in Dental Education Rethinking the DDS Curriculum. Do you have my voice?
Yes, please go ahead.
Okay. Uh, I am Aryan Zarafshar, a DDS candidate at the School of Dentistry, Tehran University of Medical Sciences, and I'm honored to be your moderator for today's session. We are privileged to be joined by four distinguished experts from around the world. Let me introduce them to you. Dr. Elene Gigineishvili from the University of Georgia, Dr. Noor Lide Abu Kassim from the International Islamic University of Malaysia, Dr. Suzie Bergman from Pacific Northwest University of Health Sciences, USA, and Dr. Shiva Shirazian from Tehran University of Medical Sciences. We are also honored to have Professor Noor Hayati Abu Qasim, University of Malaya, and Professor Rosna Zain, Dean of Dentistry, Mahsa University, joining the panel as distinguished guests. Welcome to you all.
Okay, thank you. However, I think Professor Zain and her colleague has not joined the meeting yet, and
Oh, okay.
I'm looking forward to meeting them very soon, in a few minutes. Okay, I think we can start the first part of the meeting with a short presentation by Dr. Noor Laide. Dr. Noor?
Okay. Thank you very much, Dr. Fayan, and also Aryan. Nice to meet everyone. Although this is a small meeting, but I think it's an important meeting, important discussion. A few disclaimers. I'm not a basic science. I'm not a scientist. Neither am I a dentist, nor am I I'm from social science, but I actually taught biostats at our Faculty of Dentistry for 3 years, and I did some statistic consultancy at the University of Malaya for 3 years, and also I had the opportunity to teach at the Faculty of Nursing in Saudi Arabia. So done quite a bit, involved in a bit of research with some colleagues in dentistry and also in the sciences. So I am trained and experienced in educational measurement, specifically psychometrics. So that's where I shall be coming from. All right. So I can share my screen, right? Okay. Okay. So is it shown on the screen?
Yes, we can
My
see it.
slides?
Yes.
Okay, all right. Okay, so now the title is Modern Assessment in Dental Education, and it's relating to the curriculum. And I thought that, because there's a lot of literature actually on methods of assessment and also approaches to assessment. And I thought that maybe I should share something that is more related to um, educational measurement. Okay, because I think a lot of times when people write about assessment methods, they talk about the advantages, disadvantages, and but very little actually is talk about concepts or things that are related to the design of the assessment methods. Okay, so that's going to be the perspective that I will be coming from. Okay, so I think many people are actually well versed with the concept of reliability and validity in assessment, but we talk about fairness. There are assessment methods that are authentic, and so we understand what authenticity means. Practicality, now sometimes it's dressed as viability of the assessment methods, and then we talk about fairness, and very rarely I think people actually talk about washback or the backwash of particular assessment methods on teaching and learning. Okay, so I'll go through let me see. Okay. All right. Oh, now I think, okay. All right. Now, when we talk about validity, I think a lot of times we talk about the content validity of the assessment, whether it has covered sufficient coverage of the content. In terms of predictability, it's always in the context of admission entry requirement, and so on and so forth. And I see that in the Journal of Educational Measurement, Dental Education, it talks a lot about predictive validity in the early 1930s and so on. Not much is actually talked about concurrent validity. So concurrent validity is, to what extent your assessment is measuring in the same way as another form of assessment, for example, or how one test is measuring the same way as another test. So concurrent validity is usually talk about when we're developing a new test or a new form of assessment, and to see whether it is aligned to some criterion of some sort. Then, of course, the theory base, the construct validity. Now, in some discipline, construct validity is very much highlighted, but I think from the literature that I've read in dental education, construct validity is still not much talk about. Okay, so in terms of theory of learning for dental education and so on and so forth. Now, reliability, I think, this is also a concept that we are all very familiar with. But one thing that we struggle with is actually the inter-rater reliability or inter-examiner reliability. So the use of human judgment, I think until today, it doesn't seem to be resolved. But actually in educational measurement, there are methods of actually resolving this issue. But I have not seen any paper, many papers actually, that talk about how do we deal with differences in rater opinions or rater severity, rater errors such as, intra-rater inconsistency and so on and so forth. But there are ways, actually. There are ways. So I will touch a little bit about strategies on how we can overcome this. Now, authenticity. Now, I think when we talk about assessment in dental education, in the early 1900s, when intelligence testing was born, and people are very much into standardized objective testing and so on. And then with the World War I, the World War II, with the ability for written tests to be scalable, for a large number of examinees and so on and so forth. So a lot of indirect testing was going on. So there were a lot of multiple choice tests, written examination, and so on, because we find that this type of tests very much can give us consistent results. Okay, can give us consistent results. So as a result of that, written tests, especially selected response, when you have multiple choice and so on and so forth, were very much used in the early years. But then later, with the realization that, clinical competency has to be assessed also, and of course, written assessment cannot adequately do that. So the move to more real-world direct testing, has taken place. So authenticity, when we talk about an assessment method, one of the things that we have to focus on, not just the reliability of the scores that the assessment can produce, the validity of the test score in terms of interpretation of what a person can do or cannot do, but the authenticity of the assessment method is very important, whether it is an authentic method or not. So that's the next aspect that we have to consider. Now, the other one is practicality. I'm not sure whether you are familiar with the Kurashaki Hospital origami test. This test is actually introduced by this hospital for would-be surgeons, all right, for would-be surgeons. And they give 15 minutes to complete the test. So what they have to do is that they have to fold 6 origami pieces and make it into a bird. All right. So they are given the usual instrument that you can find in operation theater, and so there's the time limit. All right. So that simulates the actual surgery environment with the low lighting and the very focused and hand skills. All right. So this type of test, it does not represent an authentic scenario, but it simulates the kind of skills that are required to some extent. All right. So stability of the hand, and be able to work under very stressed environment with low lighting and so on. So in my mind, this is a very specific aspect that is being tested, and also it is rather practical. All right, it's practical because many people can be tested at the same time. All right, so the resources also is not too resource heavy. So it is something that can be done rather well, and also rather quickly, just like the wire bending entry during interviews and so on that many dental schools use. Okay. So the next one is about wash back or bed wash. I think a lot of times when people talk about assessment methods, they talk about how reliable it is, whether it can produce reliable results, whether it measures what you intend to measure. But there's a lack of literature on whether it has the kind of washback or the effect on teaching and learning, that is desired based on that kind of assessment. Now, for example, like the approach, the programmatic assessment, right? So that's an approach to assessment. It's an approach to assessment that utilizes multiple low stakes and high stakes assessment methods, all right, to assess students' competency. So people talk about, there are papers that talk about challenges of implementation. There are not many people have tried it, all right? So there are some mixed results and so on. But very rarely, when they talk about assessment, they talk about the washback or the effect of the assessment on teaching and learning. Okay, so I think this is one of the things that we need to highlight when we talk about assessment. Okay, so the other thing that is very current now is the EPA, right? The EPA. So I think the EPA is very resource intensive, but it does have a very positive impact on teaching and learning, because the assessment and the teaching and learning are interwoven, right? Because they are very closely related. So I think the EPA is one of the best modern assessment approach. I wouldn't call it a method, right? Because there are methods, ways to assess. Say, for example, like OSCE, you have the mini CX, you have the case studies and so on and so forth. But this approach, I believe, is to be very effective, not only in terms of the validity, but also the washback on teaching and learning. But of course, with this kind of assessment method, sometimes, it's very difficult to make sure that, because you have multiple raters, you have different people, different supervisors assessing and probably assessing the students' performance on different patients and so on and so forth. So there are those issues coming in for lack of standardization and so on and so forth. But I do think that this is a very good example of an approach that would provide a good washback on teaching and learning. Okay. Now, some of the persistent issues that are still, I think, not only in dental assessment, dental education assessment, but also in medical. Okay. I think the first thing is the human judgment, the variability of human judgment. I think until today, it is very difficult to find a paper in dental education that actually talk about ways to address this. How do you adjust for differences in severity or leniency of examiners, for example? How do you make sure that, or how do you identify people are not internally consistent with themselves, when they are evaluating students' performance? And then we also have this problem of equivalence of tests or tasks across examinations and cohorts. And one of the things that in medical education and also in dental education, people do standard setting. So why do they have to do standard setting for every assessment, okay, for every semester? It's because their tests are not equivalent from one set to another set. All right, because each set has a different combination of items with different levels of difficulty, and therefore, they feel there is a need to set standards or pass marks for every assessment that is conducted. But actually, there's a way around it. All right, there's a way around it. Then the sampling adequacy, sometimes because clinical examination is time consuming. Okay, it's not something that you can have. You can sample all the different types of treatment needed and so on and so forth. So this is also another problem that I think is still there and needs to be addressed. Okay. Now, in educational measurement, we are very concerned about error. How error can creep into our assessment. Now, the object of measurement is always the person's attribute. It can be his cognitive ability, affective, or skills, clinical skills, and so on. But the other things that can come in that can bring about error in our measurement, it could be the multiple raters, the human judgment. All right, it can be multiple test forms across cohorts, or even if we have, let's say, OSCE, you have 2 different sessions, for example. In some universities, because they have, say, for example, 200 students or so, they cannot do it in one location. They have it in multiple locations, like
Oh, I think there is a problem with Dr. Noor Lide's connection. I cannot hear her anymore.
Oh, can you hear me now?
Yes, yes, yes.
Okay, good,
You are
good.
back. You are back.
Now,
Cool.
okay. So actually, I am inviting my esteemed colleagues to actually, to capitalize on the things that are happening in educational measurement. Okay? One of the important things that has happened in the last, I think from the 1960s, 1980s until today, is actually the test theory. Okay, we have moved from the classical test theory to the modern test theory. Okay, and within the modern test theory, there is a way to not to say eliminate, we cannot eliminate, but to adjust for differences in rater or examiner severity. Okay, so specifically, we can use the many-facet Roush model to do that. Okay, so when we mark, we have our different raters marking one set of students. It would be as if only one person is marking everybody. Okay, so this is a very important advancement in terms of educational measurement. And then also for equivalence of tests and so on, so there are methods, and one of the method is the common item test equating. So using equating procedures, we can make sure that tests that are written for one cohort to be of the same level of difficulty of another cohort, even without pre-testing. All right, pre-testing the items just by embedding some common items in the two tests. Okay. Then, of course, for sampling adequacy, I think this is not something that statistics can resolve. So this has to be changes in how assessment is conducted. Approaches to assessment. So I believe that approaches such as EPA and also programmatic assessment, they have a lot of potential. It's just that I think it's a matter of implementation and how do we get the resources to do all these things. Okay. All right. So if we look at the curriculum, I mean the dental education, it has come a long way, right? In the 1800s, you talk about apprenticeship, you talk about the proprietary schools, and then you move to the formal university-based programs. And then we talk about the introduction of basic clinical sciences, and then the move from discipline-based to integrated curriculum and so on. And now we are talking about integrated healthcare delivery and also about the spiral and integrated curricula. Okay, so we see the move, the change in the curriculum, and we also see the changes or the evolution in the assessment methods also, as well as the assessment approaches. All right, so we started with apprenticeship is basically direct observation. All right, and then it moved to standardized testing, and then it moved to more clinical-based assessment and structured ones like OSCE and so on. And then there's a move, I think, in the last 10 years, we are talking about programmatic assessment where it is a system-based, all right, system-based, not just talking about one-off assessment or formative or summative. And then we talk about the EPA. So we see that, there are changes not just in the curriculum, but also in the assessment methods and approaches. But I think we need to marry the two. All right, we need to marry the two. We cannot think about assessment, standalone assessments. Okay, we have to come up with an integrated approach. So maybe you would have an alternative for the programmatic assessment, because there are lots of reservations about it in terms of how it can be implemented, and also having so many assessment at very regular points is also can be quite overwhelming for students. So maybe, when we talk about rethinking the curriculum, I think we also need to think about how we want to approach the assessment. Okay, I think assessment has come a long way, but probably we need to look at it at the system level. Okay, so so that's all that I thought that I'll share with you from the measurement perspective. Just coming from my field. Thank you.
Okay. Okay, thank you very much for your presentation.
Thank you.
Because of time shortage, let's quickly go to the second presentation by Dr. Bergman, and then we will be back to your presentation, Dr. Noor Lide, and we will share some questions with you. And I will also welcome Dr. Zain and Dr. Noor Hayati from Malaysia to join us. Thank you, professors, for being with us. And also, I would like to invite the audience to share their questions in chat box. Therefore, we will ask their questions from the panelists during the discussion panel. Okay, Dr. Bergman, the platform is yours.
Thank you so much. Can you see my screen? Yes. Okay.
Yes.
Very
Yes.
clearly, yes.
So I would like to thank Tehran University for inviting me to be part of this important discussion. And my work focuses on digital technologies, integrated care, and student well-being. So assessment is a natural extension of that. In today's environment, I would say that assessment is no longer just an endpoint measure in dental education. It is curriculum design. It shapes student behavior and it signals what we value. And it sets the culture of our programs, especially in a digital era that we're in. So rethinking assessment means we need to rethink the entire educational experience, and that's what I'll be talking about today. So what do today's dental students actually need? They do not just need knowledge, they need to understand to use critical thinking skills. So they need the ability to evaluate complex clinical situations and integrate scientific evidence. They need to consider the patient's context so that they can use sound clinical judgment. And modern patients expect this from clinicians. They want them to be able to problem solve, adapt, communicate clearly, and meet them where they are. So importantly, students need to learn to listen because patients don't like to be interrupted. And meaningful clinical reasoning begins with understanding the patient's story. And while hand skills will always matter in dentistry, I think that critical thinking is the area where we've been falling short. So we have good ways to assess clinical competence, and we need students who have digital literacy, but I think all of you who are educators would agree the students are the ones teaching us digital literacy for the most part because they've grown up in what we call the TikTok generation. They play video games and they're very comfortable with these sorts of things. So when we talk about competency-based assessment, we are really discussing uh, our focus to shift from what students know to what they can actually do. So it aligns these three things: our learning objectives, the clinical experiences we give the students, and how we assess their readiness for real world practice. So an example would be OSCEs, as Dr. Noor described. And then also one that I really like is it's called reflective portfolio, which gives the student an opportunity to actually assess themselves and look for measurements that they want to improve in. Also, case-based evaluations, which help us assess higher order abilities like judgment, integration of evidence, and professionalism. So our goal is to ensure that our graduates are genuinely prepared for the real world demands of dentistry and not just the academic ones. And when we talk about dentistry in today's world, it is increasingly global. And that, I think, gives us a real advantage because we can learn from one another. So benchmarking against international standards helps ensure our students are prepared for global mobility, for collaboration, the realities of a connected profession. And of course, that doesn't mean copying another country's curriculum, but it does mean looking at what different regions are doing well and learning from one another. We have the ability to ask how your curriculum or someone else's curriculum could actually strengthen our program with adapting these best practices in a way that fits our cultural context, our students, and our systems. And when we take that approach, global benchmarking becomes less about comparison and more about meaningful improvement. So if global benchmarking helps us understand where the world is heading, this slide will focus on how we actually prepare our students for the future. Assessment shouldn't just certify assessment competence, it should shape student learning. And I believe that means shifting from memorization to application. So students are practicing how they'll actually think in the clinic. We also, I believe we need to lean more on formative assessment because feedback during the learning process is what really builds confidence. It builds reflection and growth. Technology can strengthen this. So things like simulations, virtual patients, AI-supported tools can give students repeated low-stakes opportunities to practice decision-making and receive meaningful feedback. Here's one example of how technology can support modern assessment. This is a company that I do some content, I prepare content for, and I do quality assurance. It's called Immersify Education. And this is a digital learning tool that allows students to practice procedures, test their understanding, and get immediate formative feedback in a safe digital environment. So it blends clinical reasoning, digital literacy, and self-assessment, which are all skills that we've been talking about today. And tools like this help prepare students for real-world readiness by letting them learn, make mistakes, and correct course in real time. And then I would just say, oh, sorry, I don't know what happened there. That, we have to take into account student well-being as part of our assessment because if a student is struggling, there may be reasons that we haven't considered, and we can't say this student is not a good candidate to become a dentist. We really need to understand if there's something that we can do to support them with their mental and physical well-being, because a happy student is always a successful student. And that's all I have.
Thank you very much, Dr. Bergman, for your nice presentation. And let me ask Dr. Gigineishvili, do you have any comments about these presentations? Please let us know.
Thank you, Dr. Payen. No comments at this time. I think
Okay.
last
Dr.
one.
Shir okay. Dr. Shirazian, do you have any comment you'd like to share with us?
Thanks very much. I learned a lot from these professors. I have a question if I can ask at this time.
Sure.
Professor Noor talks about the effect of curriculum on assessment. I mean that if your curriculum is integrated or discipline-based, it affects on your assessment tools that you use. I want to hear from these professors about their curriculum in their schools, as if they are the curriculum is integrated, how they assess the complex competencies like as professionalism or communication skills that they mentioned, as it is a longitudinal assessment or cross-sectional assessment, how they assess these very important competencies that most of the time neglected and don't mention as a student or as or assessors don't mention these very important competencies. If they can tell us about their experience, I will very pleasure. Thank you.
Dr. Noor Lide.
Okay, so thank you. I think what I mentioned just now is that the effect of assessment on teaching and learning, and also a possible effect on the curriculum. All right. So, but also of course, the curriculum, how the curriculum is structured, also has an effect on how assessments are carried out. You know, how methods of assessment are carried out. And I must, this is a disclaimer. I was with the dental faculty for 3 years, which was quite some time ago. And I think a lot of things have changed. So I'm not in the best position to answer that question. But probably maybe Prof. Rosna or Prof. Hayati can explain a little bit about how the assessments are done in their faculty. I'm actually with the education faculty. You know, so I move faculty, you know, I taught at different faculties, but my experience with the dental faculty was quite some time ago, was in 2012 and 2015. You know, so I think a lot of things have changed, and I would like to seek the help of my colleagues, you know, from Malaysia to help answer that question.
Okay, thank you, Dr. Noor Hayati. Dr. Zain, do you have any comment on the role? We are talking about the role of the impact of the curriculum on the assessment. Do you think that we should change the curriculum and design the curriculum based on the assessment methods or vice versa? Dr. Zain, Dr. Noor Hayati.
Yeah,
Hello,
okay.
Professor.
Hi. All right. Yeah, I think that the change in curriculum actually determines the assessment method. And at least talking about my school in Masa, we've done a curriculum review, and we started with fully discipline-based, but we actually start to move into integrated curriculum, especially for the clinical years. So as we move into the integrated curriculum, the assessment method then changes more into clinical reasoning, And of course, most of what's described by Dr. Nolide is actually being used in our curriculum to assess the students. And here I'm talking more about the clinical years, whereas in the preclinical years, I think it is more very didactic, but the move towards starting off with integrating, getting them to get used to integration. So even though in our school, the teaching is very discipline based for the preclinical, we do put in effort to have some degree of assessment that requires integration. So that
Okay.
is the move towards the integration. Yeah.
Okay, good. Dr. Bergman, do you have any comment?
I would just agree with that. I think that integration is something that we need to accelerate. And the university where I'm teaching now is a brand new dental school. It's our first cohort. And one of the things that we're doing is combining some classes with other disciplines. So we'll have the medical students learning with the dental students, or my area of expertise is temporomandibular disorders. So I like to have the students learn from disciplines like physical therapy so that when they are assessed, they're actually learning things that will be something they will use in the real world, and they'll have an opportunity to practice that in our educational environment so that it's second nature to them when they get out into the real world.
Mhm.
Can
It
I
means that
ask,
yes,
Prof.
please,
Bergman,
please.
from what I read in the US, before students do medical medicine or dentistry, they're supposed to do a degree in sciences, right?
That's correct.
Relevant field in the sciences, yes. So
It
how
doesn't
does that
always,
actually affect the curriculum and students,
Mhm.
ability to learn the clinical and the basic science subjects together?
Yeah, so it doesn't always have to be science. I mean, that is science is preferred, but they do have to complete. When I was a student many years ago, we had to complete 4 years. Now there are some students who um, take less of a undergraduate program, but it's very helpful for students to have a background, even like just the basics that when they come to class, it can be more of a flipped classroom model where they've learned something before they've attended the lectures, so that during the lecture, we don't spend all of our time describing, definitions and that sort of thing. Another thing that we do, which I think is wonderful, is for those who maybe came from an underrepresented area or their education wasn't up to par with other students, is something called pre-matriculation, so that they could have a boot camp maybe for 6 weeks or something before they start dental school, where they're having a really intense learning environment that allows them to be at the same level with their cohort, so that we're not trying to spend our time getting everyone on the same playing field. And I find that that's very helpful.
Mhm. Okay, good. Thank you very much. And if you would let me, we can. Dr. Shirazan, did you get your response?
Yes, thank you.
Okay,
Because it's
okay,
a short time, I
okay,
talking much.
okay. And Ariane, would you please share the first question from the audience with Professor Gigineishvili?
Yes, I will. Okay, Dr. Gigineishvili, if I may start with you regarding the institutional view. From an institutional perspective, what do you see as the main drivers that require dental schools to rethink their overall assessment strategies in the DDS curriculum?
Thank you, Ariane, for the question. Hi, everyone. Hello again. I'm very happy to be in this amazing team, and thank you, Dr. Payan, for inviting me. And it's very important, really, I agree, to share different universities experiences between each other. I can just share like the information from Georgia's perspective. I'm from University of Georgia. I'm associate professor at the university country, Georgia, University of Georgia, and also I'm the head of the dentistry department. So we in 2023 in Georgia, we made the subject benchmark statement of dentistry. This is the document which regulates all the national universities. And this is just like the minimal standards which all the dental schools should fulfill here in Georgia. So we have I was one of the board members of this team, and we have the consultations from different authorities with national other universities. Also, we take into consideration the WHO action plan. Also, I am the board member of the ADE, which is the Association for Dental Education of Europe, and we got also all the necessary documents from ADE to make the minimum standards for every dental program. And especially we should make the clear alignment with all dental schools to link the learning outcomes of the programs and the assessment and teaching methods. So we had a lot of consultations, meetings, and we put in our curriculums all the modern assessment and teaching methods in the curriculum. Started with the OSCE, OSPI, CBL, TBL, DOPS, Mini CX, but here I want to mention that the most important challenge here is that also the teachers should have the competency to make the correct assessment. And I think this is a huge challenge, and I think all the university representatives will agree with me, because we need also the support to know how to assess the students correctly. And in this case, I think the role of the university is very essential, because teachers need the support to have those competencies. So we make some training courses for our teachers in assessment methods, especially in OSCE, and you know that OSCE is very important for us. And we're trying to to support our staff, and we all fully depend on this benchmark, our national document. Also in OSPI, also in CBL, and then we are responsible to do these trainings, and we are able to do this for our teachers. And I think university, I want to mention the support of the university is very important for the teachers. And about the fairness, I think also it's very important to have the standardized, the criteria, the rubrics for the students, and to make everything clear for them.
Okay.
What else?
Thank you. Great, great. You highlighted the training the teachers for performing a fair, valid assessment.
Yes.
Would you please let us know that do you have a regular program at your university to train the teachers for assessment, especially modern assessment methods, including OSCE and other types of the assessment?
We don't have our national regulative office to make the trainings. I mean in the OSCE, but we have many international partners. Which we invite them, and we make these trainings for our staff. So, for example, last year I have the trainings for workplace-based assessment, WPBA, 1 month and a half. And then we train also other teachers. So we don't have the one regulatory office who provides every time those assessment methodologies, but we very often invite the international speakers for those trainings because we all attend on the different conferences. We have the contacts, we have the in partner universities, and so on.
Okay, and my last question in this section, is it mandatory for the professor to get familiar with assessment methods to promote at the university, for example, from assistant professor to associate professor or a full professor? Is it mandatory for them or not?
Sorry, mandatory to be trained, I mean?
Yes, yes. For example, at our university, it is mandatory for all assistant professor to attend specific classes to become familiar with the modern assessment methods, including OSCE, Minisex, and other types of the
Yes.
assessment. Is it the same at university or not?
Yes, sure. Sure.
Mhm.
It's mandatory.
And do you recommend it to the?
We both are accreditation and authorization experts of the university. So we all know the criteria, how the university should be evaluated, and also the specific dental programs. So in our criteria that it's written that the teachers should have the first competency to teach them, the students.
Mhm.
And the assessment is the most important thing to make it fair and standardized. So we have to.
Okay, great. Thank you. Dr. Noor Hayati, do you have any comment?
Yes, thank you for the invitation. I just like to echo Professor Bergman's concern about critical thinking and reasoning for dental students. And I just want to share that at University Malaya, now not only we have to do open book examination for postgraduate students, but also implement open book examination for undergraduate curriculum. So I think with open book examination, we can get a positive washout where if it is designed properly. And now because I'm now the head of University Malaya Dental Education Enhancement and Development Unit, we have been training lecturers and the teachers how to design good open book questions for assessment. And I think although open book is being used for in areas of engineering and probably a little bit in medicine, it is very new in dentistry. And this is where I think critical thinking, clinical reasoning will be best assessed if you look at the Bloom's taxonomy with a C4 to 5 and 6 cognitive 5 and 6, this can be assessed very, very well. So as of this year, we are all mandated at University of Malaya to do open book examination in our assessment as part of the assessment, not the total assessment, but as part of the assessment. However, we still inform the university that factual recall is equally as important for dentistry. And those we will do in OBA, that we also do in OSCE, and we also do in modified essay question or SAQ. But I also like to share that in Malaysia, we have a new act now, Dental Act, in Malaysia, where all dental new graduates have to sit for professional qualifying examination, where they have to sit for OSCE, and question will be provided by the Malaysian Dental Council. So as of January 2027, registration of new graduate to practice in Malaysia have the requirement of this national board examination. Thank you.
Okay, thank you. Let me ask you about the open book question. Could you please clarify how do you perform this kind of question? Is it practical for the high number of the students? For example, when we have about 50 or 60 students, can we conduct this type of assessment for all of these students, and how we can fairly conduct this kind of assessment?
Okay, open book examination is where at the moment, if you don't have a good cyber security, that means if you allow them to go into the internet or whatever, that is not going to be good. So at the moment, what we do is we give them references that they can bring. If we look into professional conduct, or we want to look for ethics and things like that, so they are allowed to bring some references, or for example the American Association of Endodontology, for example, or clinical guideline. Those are the things that the students are not supposed to memorize, but to be able to look for important information to link together, and to probably in their final year be able to design, for example, case risk assessment for a specific scenario or specific patient. So it's very important to give a very good scenario for the students to look at and to think about what are the important elements that they have to come up with to address patients' concern. So we felt that this is a very good way to prepare them for real world problem, and for their own practice in the future. So we are also learning. We have been inviting speakers, especially from education base, to show us and to teach us how to do open book examination. And I think we have done some survey for the student, and it is a very they welcome it, because some of the references they are not supposed to memorize, but of course factual. They have to come to the examination prepared, knowing basic foundation knowledge, without which, of course, they cannot pass the examination. So it is a written examination, and we must produce a very good marking scheme, so that we can assess the student fairly and equitable in that sense.
Okay.
Yeah.
Okay, great. I think it's a very good method to evaluate the critical thinking and also problem solving skills of the students during the exam. Thank you.
Thank
Ariane,
you.
could you please share the next question with Dr. Bergman? Dr. Bergman, are you with us?
Yes. Moving to the concept of competency, Dr. Bergman, in competency-based dental education, which competencies do you believe are currently underassessed or misassessed in traditional DDS curricula? I think you mentioned critical thinking, but I would like to hear more about that.
Yes, thank you. So in most traditional curricula, I believe we tend to overassess factual recall and procedural steps. Those are also very important, but we underassess the competencies that truly define clinical readiness, with critical thinking being one of the most important, in my opinion, and then also clinical reasoning, communication skills, and the ability to listen and interpret a patient's story. Professionalism, teamwork, and self-assessment are also often measured superficially. These are what we refer to as higher order skills, and they're harder to test with exams. Written exams, but they're essential for safe patient-centered care. So modern assessment really needs to bring these competencies to the forefront, in my opinion.
Very good. I
Thank you.
think you are highlighting the important soft skills which are commonly neglected during the education. We are commonly focused on the hard skill, technical skills during teaching, how to prepare a tooth, how to extraction for a patient or something like this. We commonly ignore these soft skills, including leadership, problem solving, and critical thinking. Thank you. And how do you think that we can well assess these soft skills? What is the main methods? What are the main methods to assess these soft skills effectively?
Well, that's a great question, and I think that's something that we're all still working on. I know a professor at uh, Oklahoma University has come up with a program where he's training the faculty because faculty needs to um, be able to measure and it needs to be standardized. So, as I don't remember which one of the panelists was saying that, but it's very important that we're not just taking subjective opinions saying this student is professional and this student is unprofessional. So we have to have a rubric and um, we have that they have to meet specific criteria,
Mhm.
so the design comes. I work with an organization called Academic Health Associates, and these are people who have much greater experience than I do at making the types of specific criteria so
Mhm.
that when like during an OSCE or during any type of patient encounter, the student is being measured on these things by observation and by as much as by outcome, by observation, what is the patient's level of comfort with the student? I have worked with students who can tell me exactly how many microns something needs to be, or, what the chamfer should look like. But when they get with the patient, there's this sudden feeling that they don't feel safe, So that's because we have maybe emphasized too much recall of facts rather
Mhm.
than communication skills and those types of things. And really, like when students are learning, uh, they learn information, but they have a little bit of disconnect in how to apply that. So, they may be able to pass a test with 100%, but when it comes to actually implementing it, there's just a missing piece there that we have to help them connect.
Okay, great, great. And I would like to highlight one part of your presentation that it is very important to make the assessment method crystal clear for the students to assess them fairly. It is very important, I think, before getting started the assessment. It is very important. Dr. Noor Lide, I think you have a question or comment.
Oh,
Could you
yeah.
share it with us?
Yeah, thank you. I've actually put it in the chat. Prof. Bergman, is it possible that these under-assessed areas is due to partly to the lack of coverage in the curriculum?
Lack of coverage?
Coverage, yes,
Yes.
yes.
Yes, definitely. I think that's what we're learning is that we've really I wouldn't say we're failing students, but I think that we're not giving them enough opportunities to practice in a low stakes environment. So like with Immersify Education, students can they can use AI patients where they're able to hear the patient's chief complaint and then they're able to determine like, what the treatment needs to be, if there's any medicinal management, what the dosage should be, those kind of things. And they're learning in an environment where if they fail, they haven't hurt a patient. So I think that's something that we really need to work on. We have, simulations and activities where they can give anesthetic and then they can get immediate feedback. Was their choice of anesthetic correct? Was the needle correct? Was their placement, correct? And when students have an opportunity to practice things like this without consequences for making mistakes, they come into the clinic much more confident.
Great. Thank you. Thank you very much. And Dr. Gigineishvili, I think you have a comment.
Yes, just I want to share our practice at the University of Georgia. We provide the OSCE exams from the second year, from preclinical, also in the clinical studies, and we invited with the contract, we have the real actors from theaters. And in OSCE stations, like before the exams, we train them with how to share the symptoms. And that's how we measure the communication with the patients. They fill with these actors the medical cards. They are making the deep diagnosis with them. So they are very important people for us. So maybe you'll also.
Sorry, you invited a real actor to the.
Real actors.
Great.
Real
Great.
actors, and each field head, for example, surgeon, endodontist, they have the meetings with those actors, and they are like giving them the instructions, what kind of symptoms they should share on OSCE exam. And we manage like the different cases on OSCE exam. So it's very interesting and also funny, to be honest.
Thank you for sharing this great
in terms of
experience with us.
communication. Of course, we don't do any procedures on the actors, just to measure the communication skills.
And may I ask it, a private question? How much did you pay for this actor?
I will tell you privately, not here.
Okay. Sorry, Dr. Bergman. Any comment?
Yes, I was just going to say I attended a university that does that here in the United States and had a standardized patient after a lecture that I gave, and the actor was very good, but also very expensive. And I think that's another reason. I mean, I think it's a wonderful thing, but it's another reason why we also have to look at using, AI patients, because we can come up with many scenarios, and we can reduce cost a little bit. But there is definitely something very valuable about the human interaction, and I think that's a wonderful thing when it's, not cost prohibitive.
Good, great. Dr. Shirazian, do you have any comment on this? I think you, at your center in Medical Education Center at Tehran University of Medical Sciences, you have a center for training some people to act as a patient. Do you have any experience about it?
Yes, as you mentioned, we have a standards patients collection that you can ask them and learn and teach them the scenario that you need, and because they have a lot of experience to participate in different exams in medicine or dentistry or other schools, they play very well. When you teach them, they can play very well. As one of our experience that they was about the psychological exam, that one of the SPE played very well the role of the bipolar patient, and that after that every doctors who saw him thinks that he's
The real patient, the real
the real
patient.
patient. And
Great.
I think it's very good for OSCE stations or other exams that we need, especially soft skill, as you mentioned, for communication skill. As you remembered, we use our students in last year of their near they want to be graduated. We use as them for SP patient in our communication skill station exam,
Okay.
and they play very well.
Okay,
Thank you.
thank you. Dr. Noor
May,
Hayati.
we usually have a pool of patients. However, recently we contacted the Faculty of Drama and Creative Arts at the University of Malaya, and the students, the drama students, are very excited, and they actually do very well as simulated patient for OSCE. So and we for students, because they like acting and going through the scenario, so they are very happy at when a token, and to them is such an experience to be able to act a clinical scenario. So that is also one choice if you have faculty of creative arts at your university.
Great. Great, thank you. Aryan, I think this is time to the next question. Would you please let me ask it personal questions from the panelists? You know, I have a question about, I would like to know the idea about a very important issue. Do you agree with a formative assessment or summative assessment? I think sometimes we would like to assess and give them marks for pass or fail or something like this. However, I would like to know that if the panelists agree with a summative or formative assessment. Dr. Bergman, could you share your idea with us?
I do believe that a summative assessment is valuable. We in everything we do, we're building on what we've learned, right? So, we have done this kind of this traditional grading system, where it's pass fail, and
Yes.
and there are many variables that are not measured in a pass fail type of situation. There may be students who are experiencing outside factors that are affecting their ability to be assessed on any given day. And so I know some very talented dentists who maybe their grades were not reflective of their abilities, because it was just a matter of where they were in their personal journey as well as their academic career. So I think that there is benefit to learning, to reviewing what someone has learned, and making sure that they retained it, that they didn't just regurgitate it for the purpose of the exam. I don't know if that
Okay.
answers the question, but
Okay, Dr. Noor, Lide, do you agree with the summative or formative assessment? Do you recommend teachers to release the correct answers of the questions after assessment, or do you agree with the keep the correct answer as a secret and don't release the questions and correct answers?
Okay. I wonder if this is a trick question. Actually, I think formative and summative assessments, they have different purposes. They are
Yes.
equally important. One is to, for the learning, and the other one is to make sure that competency is achieved. All right. Normally, I'm also a lecturer. So test writing is very time consuming. And to come up with really good questions is not easy, So one of the things that we worry about is test security. If we share the answers, then therefore, we cannot item bank. We cannot bank the questions. And therefore, we have to every semester and every time that we do an assessment, we have to come up with new questions. And of course, the issue of whether we can come up with questions that are comparable in terms of difficulty for the different cohorts and so on, So equivalence is an issue also. And but of course, I think students need to know where they've gone wrong, where they had misconceptions and so on and so forth. So those things are important. And I think questions should be discussed. All right. And why they've gotten their answers wrong and what should be the right answer, for example. I think that has to be discussed as part of the learning process. So that's feedback. So that is important. But issues like, many institutions, I think we don't release our final exam questions because we go into item banking. And as you know, it's difficult to come up with good questions, especially the OBA. The one best answer is really, really very, very challenging to come up, with a really, really good questions. The other thing is that about the pass-fail thing, the pass-fail. Now, if you just make two categories, pass or fail, then the precision in your measurement, you don't have to be very precise because you only have two groups, those who can do and those who cannot do, those who have the knowledge and those who don't have the knowledge. So that's a bit easier to do than if you have grades, So grades, you need to have final precisions at all the different points and so on. So you need then to make sure that your assessment can give you highly accurate results, but also I think in terms of confidence of the patients in the doctors, in the graduates, if you have grades, you want to have a grade A dentist to treat you, not a minimum standard person to value you. So there are pros and cons for that. But one thing that I like about the practice in school, I'm not sure about school in other countries, but in Malaysia, what happened is that, say, it's a third grader, so the student has the first term examination, and then as the learning progress, they learn new things and also consolidate what they have learned earlier. They have the midterm test, and then they have the final exam. So only the results of the final exam is taken into account, meaning that they've gone through all that learning process and, they've learned from their mistakes and so on. And that final score, only that final score matters. But in universities, let's say in my faculty, like in education, we have this continuous assessment. So everything is counted. Say when they are just into, let's say, 4 weeks or 5 weeks of their learning, and we already give them an assignment, and then, the next couple of weeks or so, then we give them another assignment, and we sort of sum up all those things, and then we give them a final score. But I think that somehow don't jive very much with my view about what learning is, because learning is a progression. So I would prefer to take the students' best performance as an indicator of whether they have attained the learning outcome or not. Sorry for the long explanation. Yes.
Great. Thank you. Ariane, I think this is time for the next question from Dr. Gigineishvili.
Okay, can I add a comment?
Yes, please. As a voice of a student.
Yes. Okay, so when the professor said that it is time consuming and it's hard, I mean, of course it is, and I think that for one chapter, how many questions can you create? Maybe 100. After the 10 years, all the students have every kind of question that can be created from that chapter. But now with the modern technologies, with AI, you can do something like that. Sending all of your questions, sending the chapter and say, create some questions that are not listed below. And it can actually do that. And also you can send your question and say, change them so they have a different answer. And it will be just in few seconds.
Okay,
Can I respond to that, please? Can I just
yes,
1
please,
minute?
please.
Yeah, actually, I think we also have to look at assessment, not assessment of learning, but also assessment as learning. Because I think one of the things that happens in medical education is that there are some questions that come up every year, and the students know that those questions are going to come up. So what it does is that it tells the students that this is an important is something that you should know, and you should be able to answer. So that is using assessment as a learning tool. All right. So probably if we run out of questions or we have to use AI to generate some questions, probably we also have to think about assessment, not so much of learning, but also assessment as learning, as tool for learning. Yeah.
Okay, good, great. What's your recommendation, Ariane, for the assessment? Do you recommend us to provide all assessment from AI?
I mean, the answers are very helpful for learning those things. For example, when I do an exam and I just receive my score without knowing which one I just missed or I answered truly, it's just mislearning. I don't know where I did kind of lack of knowledge.
Your recommendation is that you recommend the professor that release both questions and correct answers after the exam.
Maybe only answers is enough, as we have in our universities.
You would like to know where did you make the mistake? How did you make the mistake? You would like to correct your mistakes and prevent any repeat of the mistakes. Okay, Dr. Bergman, do you have any comment?
Yes, I have to actually. Sorry. I just want to provide a little caution about AI generated questions because I have seen that there's a big difference in what you're going to get from AI when you know the subject matter and you're using it more as augmented intelligence instead of artificial intelligence. If I put in a question for AI and I say, here is the material and I want you to give me 10 multiple choice questions, I could give that exam to my son who has no background in dentistry, and he could do very well on the exam because AI is good at writing the questions, but not at writing the answers for multiple choice. So we have to be very careful with that. The multiple choice correct questions are obvious, and the incorrect questions are recycled so frequently that you can tell they're not the correct answer. My second comment is in response to Ariane, I think it is very important to let students know where they went wrong. If they think that they got the correct answer and they hold that incorrect information in their mind, they're going to continue down the wrong path. So in real time, they need to find out where they fell short and how to course correct. And I think that giving them opportunities for asynchronous learning is very helpful in terms of allowing them that course correction.
Good comments. Thank you very much. And Ariane, we have just 5 minutes to wrap up the meeting. Therefore, would you please share the next question with Dr. Gigineishvili?
Okay, I will. So, how can academic leadership ensure fairness and consistency in assessment when faculty teaching styles and expectations differ significantly?
Good.
I think this is the my answer on Arian's comment, which you mentioned before. That I think which you mentioned about the feedback. This is the most important thing, and this is the student's right to receive the feedback from each assessment. And I think that to ensure also the subjectivity of the teachers, we should have the standardize the rubrics, which I'm pretty sure that all the university provides, but also the appeal mechanism, which should be done for the students. Also, it must be very clear, because we in University of Georgia, we provide them, if students appeal for especially in OSCE exams, we have equipped all the OSCE stations with the technologies, with a video, with audio recording, and we always show them the recording where they made the mistake, because it's their right to know, they to have the evidence. But it's very, very difficult to manage in terms of many students, so it needs time, but we are doing that. And also in case of subjectivity and assessment, also very important to monitor the teachers as well, which we have the right as the university representatives, and quality assurance office really do the great job to make some monitoring. And after each exam, we collect the questionnaire for the students separately, and also for the staff and teachers separately to receive all the information, what they think, how they think that the exams were conducted. And I think this is at each end of the semester that it gives us a lot of information which we should improve, because we should improve it after every semester, and I think we all need that. So to give the feedback, it needs a lot of time from the teachers. We all agree, but it's their right to receive.
And do you have a separate quality assurance office at your university, at your dental school,
Sure.
to provide all of this information for the teacher, to provide them feedback about each assessment during the semester?
Yes.
Okay,
Yes.
good. And I think that it is necessary for all dental school to establish such a office to evaluate all assessment during the semester and give the teachers a true.
We have the responsibility as the head of the faculties to provide the analysis after each semester, which we do with the support and with help with quality assurance office. So we do it together.
Okay, good.
And also there is another challenge when sometimes students don't want to fill the questionnaire. Also, that's the case.
Yeah.
Sometimes they just skip the pop-up, and we are making the pop-up pages on the website they cannot see their evaluations without filling this questionnaire. Sometimes it's like that, to let them fill out the questionnaire, but after each semester and also after the exams.
Okay.
I'm just curious, what happens to a faculty member that does not perform?
What happens, sorry?
To a faculty member, to the teachers, if they do not perform well in the conduct of the assessment. So maybe they have problems with consistency in the assessment, or they give, marks that are too.
We have separately the exam center, and specifically in the dentistry field, we have separately the OSCE center because we have many OSCE exams. So the head of OSCE center is responsible to train every teacher before exam. So we as a team, because we know that we mustn't communicate with the teacher. So OSCE have we'll know that some specific requirements. So we try our best from our side to train the teachers also and to show them the rubrics and the criterias before the exams. And also about the criterias, also from the first day of the study, we explain each syllabus for the students. So what kind of examination they will have, what kind of rubrics, what kind of criteria, and how they will be evaluated. So it's a really huge job to do.
Yes. Great. I'm willing to continue this very interesting discussion. However, time is over and I have to wrap up the meeting on time. Therefore, I would like to sincerely thank all of the panelists for accepting my invitation to join this very interesting, fascinating discussion. Ariane, are you ready for sharing the certificate of appreciation to
Yes, I
the
am.
panelists?
Yes, yes. Just give me a second.
Okay, thank you again. And it was very interesting. And I will definitely share this video with the authorities of my school and also with all of the participants. We need such experience sharing discussion and to share our uh, experience with each other. First of all, I would like to thank my friend, Dr. Elene Gigineishvili. Thank you for joining us
Thank
in this
you.
discussion. And I'm looking forward to meet you again in other programs.
Yeah, for sure.
Thank you. And the next one, Ariane. Yes. Thank you, Dr.
Thank
Noor
you.
Lide, for joining us, for sharing your brilliant experience with us. And also, I would like to thank Dr. Noor Hayati. Thank you for joining this meeting, and also Dr. Zain. And the next certificate, Ariane, please. And also, I would like to thank Dr. Bergman for joining this program. And I hope to keep in touch with us. And it's our pleasure to be in touch with you.
Thank you so much. It was really wonderful to meet all of you and learn from you. I appreciate the invitation.
It's very kind of you, Dr. Bergman. And the next one, Ariane. Okay. And my colleague, Dr. Shirazian, thank you for being with us. I know you are very busy these days, and it's very kind of you to share your time and knowledge with us. Okay, thank you again, and please be in touch with us in future for the next program at Tehran University of Medical Sciences. Thank you very much.
Thank you very much.
Let's
It's a
let's have
pleasure.
a,
Yeah.
sorry. Ellen well know that I am very interested in group photo. Therefore, please please turn on your camera and let's have a group photo And
It's turned
Salar,
on. No,
yes,
camera
yes.
is turned on.
Salar, are you with us? Could you take a group
Yeah,
photo?
sure. Yeah. I
Thank
I
you.
will take
Thank
the
you.
photo. Yeah.
Thank you. And please share it with all of the panelists and audience.
Yeah, sure. Okay, everybody ready? 3, 2, 1. Capture. Once again. 3, 2, 1, and capture.
Thank you.
Thank
Thank
you.
Thank
you.
you, everyone.
Thank
Thank
you.
you,
Thank you for
everybody.
your time.
Bye.
Bye.
Bye-bye.
Thank
Have
you
a
very
nice
much.
day.
you and
Have a nice
goodbye.
time.
Bye-bye.
Thank you.